Welcome to Deuk Spine Institute. We're going to be performing a bilateral, that means both sides, piriformis muscle release. Our patient comes from Canada. She's had 5 years of chronic back pain. Unfortunately, once you injure a disc in your back, you have back pain, your spine stays straight, you bend over to pick something up while you're twisting, and you end up tearing your piriformis muscle. Once that muscle's torn, it never stops hurting, and you just keep re-injuring it over and over and over again. All right, Yana, you see how I'm using the metal to localize where I'm going to put my incision? All right, folks, so the piriformis muscle, once torn, it hurts like hell. It just keeps getting torn over and over again every time you move. The only way to get rid of that pain is to release it. So I pioneered and patented a new way of releasing the piriformis muscle in a minimally invasive, bloodless way that is an immediate recovery and 100% effective. And that is called the Deuk Piriformis Release. I just got the patent about a month ago from the United States Patent Office, and I just got the actual paper patent today. It's pretty beautiful. Anyway, long story short, show us where the piriformis muscle attaches. Shot? No, take a shot. Now, see that little bumpy bone right there? It's the top of the hip. It's called the greater trochanter. Medial surface, which means the inside surface right there. That's where the muscle attaches. We're going to detach it there. Shot? We do it with a 4mm incision. Shot. All right, numb. We're going to numb up the skin first, and then we're going to make a tiny little 4mm incision. Now, if you've ever watched piriformis release done by other doctors, they make a huge incision on your butt, about 9 inches, and then they cut right through your gluteus maximus, minimus, destroys your butt muscles forever. So I decided we got to find a better way to do this for patients, and I pioneered this technique, and first in the world to do it. And basically, that's what we're going to be doing for this patient from Canada. Shot. We've done hundreds of them now. I mean hundreds. And the patients are so happy with the results. Their pain goes away instantly. It gets replaced by a new pain from my surgery, which hurts for a few days, maybe even a week. All right, so what I'm doing is I'm using my probe to feel for the bone, which I can feel now, and then I use the X-ray to check. I'm a little below where I need to be. I want to be higher up, right there. And it's very slippery bone, so you got to kind of be careful. Shot. All right, that's perfect. You see the tip of my probe there? That's right where the muscle attaches, and I'm going to start releasing it now. This is a permanent treatment for piriformis. Oh yeah, I can feel it. You hear it, right? You can feel the scarred tendon from all the inflammation trying to heal for years. You can feel the scarred tendon. It literally feels like guitar strings, like if you're plucking guitar strings. It doesn't make as nice of a sound as a guitar string, but it's, you know, you're getting them when you feel and hear the guitar string. I'm going to check position. Shot. Good. I'm right at the kind of middle of the muscle there. Yeah, okay, there. Shot. All right, there we go. That's beautiful. I'm right at the top fibers right there of the muscle. Another 30 seconds and we're done here. All right, that's it. So we did one side. We're going to put some medicine in there because it's going to hurt. She's going to complain about pain right in her buttock, right where I did the surgery. That's going to be hurting her for about a week, but it's a new kind of pain. The old pain will be gone. And by the way, let's show the audience the incision here. Pull away, Jordan. Look at this, guys and gals. He, she's, and however you identify yourself. It's literally 4mm. It's tiny, right? There's a little bit of bleeding, and that bleeding is just minimal, but that's what hurts, is the blood. That's why people have pain afterwards for about a week. The blood is irritating the muscle. So, but that's it, right? So all those years of suffering gone with that one quick procedure. Next side. Let me have a roll. We're going to get the other leg done. So my team is getting the patient positioned. I'm going to hold pressure so that the bleeding stops if there is any. All right, very good. Shot. Again, we're going to target the same spot. Yep, right there. We're going to numb skin with some Novocaine. And then we're going to make a tiny 4mm incision. And I'm going to head down to the bone, and I'm going to dock my probe right on that bone. Where is it? Once I get to the back of that greater trochanter, once I know exactly where I'm at, I'm going to start releasing the piriformis. But I'm going to use the X-ray machine to help guide me. I'm a little low. I want to be a little higher. Any questions, by the way? Oh, we didn't even show the video. Let's show the video on how we do the piriformis release.
Copy that.
Shot.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from our animation that the treatment requires releasing a muscle that just keeps getting pulled on and keeps getting re-injured. And that's what we're doing. We're releasing that muscle. There's a lot of it on her left. Her left was less symptomatic than the right. Shot. She had more right buttock pain than left, but I have a feeling with this amount of scar tissue, the left was going to get worse over time. All right, I'm pretty happy with that. We're done. Any questions or comments?
No current questions, but we do have a few comments. This first one is coming from Frank on YouTube.
Frank, thank you.
Saying, Doctor, you should try to be a guest on someone's podcast like Joe Rogan's podcast. These surgeries would be worldwide in a matter of days, if not hours. By the way, yeah, that's it.
Listen, thank you. I really appreciate your concern. The problem is that I'm a very kind of reclusive guy. I don't know anybody out there. I don't really get involved in the political scene or social scene. I just come and take care of patients. I go home to my garden, my kids, my wife and kids. I don't know these kind of people. I don't know how to get in touch with them. I don't know how to access them. So any help you guys can give us would be great. I would be happy to go on Joe Rogan. I go anywhere to promote better medical care for people. I just don't know how to get to these influential people. So if you have any ideas, we're open to it.
And then lastly, coming from Scott once more on LinkedIn, saying dentistry has a similar dye for cavity detection. P.S. The fastest way to contact Elon would be to post on Twitter. Surprisingly, he reads a lot.
All right, Henry, please do it.
We'll definitely try. We'll see why not.
Do you have
right?
a Twitter account?
Yes, I do. We could definitely.
Or if Deuk Spine has a Twitter account.
Yeah, Deuk Spine. Yeah, we have
just
one.
Go in there and post to Elon and say, Elon, Deuk Spine Institute wants to help you. Check out our YouTube channel. Check out our website. Maybe we can help you.
Yeah.
Let's do it.
Let's
do
see
it,
it.
please.
We'll see where it goes. Yeah, I'll do it right now.
Awesome. Thank
Huh?
you. All right. Thanks for joining us. We're done. We lost about 1 cc. No, not even a full cc. I'm going to call it 0.5 mil of blood for both surgeries. And we're done. She's going to go back to her hotel in about an hour. That's how quick recovery is. Thanks for joining us. We'll be back in 30 minutes. No, 45 minutes because people got to eat. What are we doing next, folks? 3-level facet. Yeah. 3-level DLDR with facets. Got it. Yeah, that's right. I remember who it is. All right, very good. We'll be back shortly with another lump.